Good day. My name is Jim Rodriguez, and I'm a research scientist here at the McSilver Institute for Poverty Policy and Research. I also am a member of the Community Technical Assistance Center and work on providing training and technical assistance through the Assistance Center throughout New York State, in particular on issues related to trauma-informed care. I'm also adjunct faculty here at the NYU School of Social Work and a therapist in private practice, again, with expertise and specialty in trauma and trauma treatment. Today, in recognition of Mental Health Awareness Month, which is May, and in particular Children's Mental Health Awareness Day, which is on May 10th, we're going to be presenting this pre-recorded webinar on resilience-informed services and helping providers to think about how they can design and deliver resilience-informed services from a trauma-informed lens, and in particular to children who've been affected by trauma and toxic and chronic stress. What I'm going to do today is talk a little bit about resilience and why we think resilience is important, and then talk a little bit about specific practices that can be implemented to create trauma-informed and resilience-informed service environments. So first, just a little bit on resilience. This definition of resilience is the one that we typically work with here at the CTAC. We view resilience as a dynamic process reflecting positive adjustment despite significant risk or adversity. A couple of things about this definition. First, let's look at risk and adversity. So from a resilience perspective, resilience is anything that has high odds for maladjustment, such as maternal depression, community violence, low-income status and poverty, low-resourced education in schools, or the combination of any of these cumulative risk factors, and of course, exposure to adverse childhood events that have great likelihood for consequences, long-term consequences on mental health, behavioral health, social outcomes, and actually physical health as well. So when we talk about adversity from a resilience perspective, we're not talking about, for lack of a better word, garden variety stressors. We're talking about severe and chronic and toxic stress. And then the other part of this definition is positive adjustment. So positive adjustment is anything that is a much better than expected outcome given the risk exposure. So for example, for someone, a child growing up in a home where there is parental mental illness, mental health can be a measure of positive adaptation. For someone growing up in, or a child growing up, or a youth growing up in a neighborhood marked by community violence, growing up and not being violent or aggressive, or being physically well and avoiding harm is a resilient outcome. There are many other resilient outcomes. The bottom line is understanding that resilience in the context of mental health services especially, and from this definition, is an outcome, not a characteristic of the individual. And in many ways, this understanding helps us to think about mental health services more clearly. It helps us to understand that resilience is critical to helping people overcome trauma and chronic stress. It provides guidance and understanding about what helps people overcome on a larger scale, on a broader scale than many of our treatment and service approaches currently do. And then it also provides help to both providers and recipients of care that help can come, but it has to take a multidimensional approach, and I'll talk about that in a second. And the bottom line is we feel that if you take a resilience approach and think about comprehensive resilience-informed services, we can break the cycle of things like intergenerational poverty and intergenerational trauma. So the reason for this, and the reason why I'm saying this, is because this is our model of resilience. So when we think about resilience using that definition and understanding resilience as an outcome and not an individual characteristic, then the goal of our interventions is to help people who have been exposed to trauma and chronic stress overcome their adversity by increasing their resilient capacities. So resilience factors can include individual strengths, individual abilities, such as problem-solving skills, self-control, emotional regulation, motivation to succeed, and self-efficacy. These are just a few individual strengths that young people can have that help them overcome adversity. But in a resilience-informed approach, individual services can focus on building these in young children and youth who don't have them or who have had these capacities strained over time. So we can focus on building those individual strengths. But of course, from this perspective, there is an important role for significant others, external factors from the individual that need to be paid attention to if you're thinking about building resilience. So when we think about significant others, of course, the attachment systems or relationships to parents and caregivers is critically important in understanding how to build resilience in young children. And this can include other caring adults such as mentors and close peer relationships as young people grow. So in a resilience-informed service environment for children and youth, interventions can also focus on building family strengths to provide supportive parenting, or providing opportunities for pro-social involvement with peers, or connecting youth with mentors. These, in addition to building individual strengths, from a resilience-building perspective, are critical as well. And then systems such as effective and trauma-informed schools or mental health services, as well as neighborhoods and the quality of faith and hope embedded in spiritual and cultural beliefs can also play a critical role in building resilience. And from this perspective, we can also address some of the underlying factors that contribute to family stress, such as poverty, lack of economic opportunity, food insecurity, poor housing. So from this perspective, a resilience-building approach needs to be comprehensive in order to overcome and help individuals overcome chronic stress and adversity, but to break the cycle of poverty and intergenerational trauma that I previously mentioned. So a little bit about resilience-informed service environments. So this work that we're presenting today comes from a learning community that we recently implemented, an initiative that we started here at the CTAC called RISE. It's a learning community that is actually currently ongoing. And what is RISE? Well, it's based on work that we've been doing for a long time on trauma-informed care and trying to help build knowledge and awareness about trauma-informed care. But one of the things that we realized as we've been doing that work is by simply increasing people's knowledge and awareness of trauma, oftentimes without providing specific practices that can help them understand how to build resilience, can often be daunting for service providers. So we've begun to look at how to build resilience and helping service providers understand the importance of resilience and how to build it. And so what we've been doing is moving from being trauma-informed to resilience-informed. Now, we're not talking specifically about trauma treatments, although I'm going to talk a little bit about trauma treatment as I talk about specific practices. But again, we're talking about a more comprehensive approach to addressing issues of trauma in children and their families, as well as the important practice elements towards building resilience. So in doing this work, we've kind of looked at the literature, and we came across some work by Wilson and colleagues here, and they conducted a content analysis of documents describing trauma-informed approaches specifically in domestic violence services, and they identified these 6 practice clusters, each with a set of concrete practices that are critical to providing trauma-informed services in domestic violence programs. But in reviewing these principles and practices, we believe that they're appropriate guiding practices in trauma-informed care in general and resilience-building services as well. So we're going to review the principles and practices and provide some rationale for connecting these to trauma and resilience-informed care, with a particular focus on the needs of children and youth exposed to trauma and chronic stress. So first, the first practice cluster is promoting emotional safety. For each of these, we're going to provide a goal and rationale. Very simply, the goal for promoting safety is to create a psychologically safe environment for service recipients, whether they are children or the families of children exposed to chronic stress and trauma. And the rationale is focused on the fact that people, young children and adults exposed to trauma and chronic stress, often are self-critical, self-blaming, and may feel threatened by judgment and criticism. So this is all related to our understanding of the human stress response and how chronic stress exposure can affect the human stress response and lead to problems with emotional regulation, but also problems with beliefs about the individual, beliefs about the self that can be baked in as a result of trauma and chronic stress. So some of the practice elements in this area include creating an emotionally safe environment, of course, avoiding embarrassing and shaming young people and their parents who've been exposed to chronic and toxic stress and trauma, and in particular with parents, because oftentimes parents may be in some ways or made to feel responsible for the trauma that their children have been exposed to. And so embarrassing and shaming them can often lead to them disengaging from services. So it's very critical to provide accepting messages about trauma. Accepting messages here, what we're referring to is understanding the acceptance of trauma, understanding that it has occurred, and understanding there are things that we can do to help children in their families overcome. Using respectful language, calm tones, the choice of words, how we refer to people, using a people-first approach, avoiding labels and labeling folks by their diagnoses or by emotional disturbance, being very intentional and clear about the way in which we treat folks with respect and dignity, despite the fact that they have been exposed to chronic stress, and even removing words like victim, and emotional disturbance from our language becomes critically important. And then, of course, providing safety measures. When we talk about SUDS ratings of safety, helping young children and their parents understand that safety is paramount in the work that we do, and providing them the opportunity to share and talk about the level at which they feel safe. So I often give my children and their parents a scale of 1 to 10. How safe do you feel? With 1 being not very safe and 10 feeling very safe. And that's very useful to help build their capacity to regulate their emotions, and also critical to help understand that as we talk about trauma, they may be triggered and their safety levels may decrease. And so we have to modulate our approaches depending on that. And then, of course, when they do feel unsafe, giving them the tools to identify a safe or happy place through imaginal guidance, and helping them to identify those places through their imagination, and go to that place when they feel unsafe. So these safety measures are critical to doing the work and have to be established first. And then also thinking about non-judgmental, gentle, questioning ways to help people tell their stories. And I'm going to talk a little bit more about telling their stories in a little bit. But altering the questions that we do and the ways we do intakes and the way we gather information from families also becomes critically important, because the ways in which we do that can often be traumatizing, can be incredibly invasive, and can be incredibly off-putting for both the children and their parents as we take information. So we have to be mindful of those things when we're promoting and creating safe environments. The second practice cluster is choice and control. So in this, the goal is to provide opportunities for people, young people, families, parents to tell their stories. And in particular, when we're talking about exposure to trauma and chronic stress, telling their stories related to that exposure. The rationale is that healing from exposure to trauma and chronic stress starts with talking about it. So with this, some very important practice principles are providing appropriate time and space to talk about these very personal and incredibly triggering and emotional events in their lives, and making sure that the space is private and that young people, as well as their parents, are given the privacy and confidentiality to talk about these incredibly personal and devastating events in their lives. Providing choice to share. So one of the things that I think is critically important when we think about trauma is, yes, we have to provide support to allow young people and their parents to share about the trauma, but we also have to provide that choice in when and how much they share. So one of the things I always like to say is, with the folks that I work with, is I'm always going to ask you about it, but you have a choice as to whether and how much you want to talk about it. But I never try to reinforce the idea of avoidance. So if they're not ready to talk about it, I am willing to move on, but I'm always open to it and always will come back to it and give them the space to talk about it. Pacing conversations, of course, and pacing conversations by utilizing the safety measures that I talked about in the first practice cluster is critically important. And then offering non-threatening alternative ways to talking. This is especially important for young children, so giving them alternative ways of telling their story through pictures, through art, through sometimes through music and poetry. These are alternative ways of telling their story, so that's the other significant piece of building in choice and control, is giving them those opportunities as well. And then choice and control on a larger scale, so that's regarding treatment and identifying and processing trauma, but there are some other aspects. At the more at the organizational level, it's critical to provide opportunities for people to shape the focus of their work and to influence program services. And from this perspective, I'm not only talking about how do you deal specifically with the individual children or their families, but also how, as programs, we build in choice to service recipients. And in this case, it includes the children and their parents. So, and the rationale for this is, again, people exposed to trauma and adversity may feel little control over their lives, over their thoughts, their feelings, and behaviors as a result of dysregulation of their human stress response over many years. So in this particular case, we need to emphasize shared interactions, being willing to learn from children and families about their experiences, and respecting the expertise that they have about their lives. There's two experts in the room always, the family and the service provider. And the children, all of which have some expertise to bring to helping people overcome adversity, trauma, and chronic stress. So these are all different ways in which, as a program, we need to approach services. In addition to that, there's also ways in which we can include children and families as service recipients in designing programs. So that includes organized listening sessions or town halls with parents about trauma, about the services that you're providing and the degree to which they are meeting the needs of children and families. Doing anonymous surveys in waiting areas to identify ways in which programs can be improved or ways in which programs might be difficult or not meeting the needs. There's a lot of different ways to include recipients of services in the design and delivery of programs. The next practice cluster is facilitating connections. The goal here is to support parenting relationships, but actually much broader, other relationships, connections to others. The rationale is that trauma can be intergenerational, and trauma-informed care is this opportunity to break the cycle. So it's critically important to include parents in treatment for young children, and that includes psychoeducation on child trauma, psychoeducation on vicarious trauma, and how parents can be vicariously traumatized through their children's exposure. It could also include psychoeducation on things such as intergenerational exposure to trauma and historical trauma, and understanding the legacy of slavery and racism and discrimination, as well as the legacy of poverty within a family that can impact trauma. All of these things are critical to helping people understand and make the connections between their current situations, their past, and also what they can do to overcome. In addition, many evidence-based treatments such as trauma-focused CBT, that's noted there, TFCBT, include parallel parent sessions so that parents are included in the treatment throughout the process. And then, of course, there are many positive parenting programs out there. PCIT is one, parent-child interaction therapy is one that's very comprehensive and very detailed around giving parents the skills to provide supportive parenting to young children, especially children who are presenting with serious behavioral problems, but there are many other approaches to positive parenting. But again, from a trauma-informed or resilience-informed approach, you have to be building the family and parenting environment to support children who've been exposed to trauma. And then also connecting parents with community resources. And those community resources might be providers that do provide, community resources are other providers who can provide services in these areas, whether they're trauma-specific services or parenting programs. And then there's also group interventions for childhood trauma. CBITS, Cognitive Behavioral Intervention for Trauma in Schools. It's a very well-known program delivered in schools that work with groups of children who've been exposed to trauma. These are various ways in which you can increase those connections and help young people connect and develop supportive relationships with adults and peers that can help them overcome trauma and chronic stress. The next practice cluster is supporting coping. So supporting coping, the goal is strengthening the coping strategies. Now this is, in this section I talk a little bit more here about specific trauma treatments because many trauma treatments that we have out there focus in general on helping people cope with and overcome and deal with exposure to trauma and chronic stress. So of course the rationale is here. People exposed to trauma and chronic stress have strengths that can be built on. And again, so from a resilience building approach, we focus on helping to build those skills around problem solving, emotional regulation, and positive coping. And that includes using evidence-based treatments or practices like trauma-focused CBT that can help young children, give them the skills to cope. And those approaches do strengthen coping skills. They provide cognitive coping skills, cognitive restructuring strategies, emotion regulation skills, relaxation and breathing, and ways to contain themselves when they're triggered by traumas. So all of these are ways in which we can provide very specific trauma treatments. But in addition to that, there's many other approaches that we can think about, helping children and families connect to, if it's important in their lives, their church, temple, synagogue, religious and spiritual beliefs that can be that can help to promote coping, and quotes, poems, and affirmations. And then also thinking more holistically about diet and healthy lifestyle habits, exercise, and the importance of positive thinking. All of these have to be considered, and they're not always necessarily part of those trauma treatments, evidence-based trauma treatments that we look at, but they can also be critically important. Thinking outside the box when we think about treatment services. And the next one is responding to identity and context. In this practice cluster, we're talking about helping people from marginalized groups feel that services cater to them. We have to think about the physical space and services being inclusive and welcoming of people from all backgrounds. So when we think about responding to identity and context, we're talking about the written materials and reading materials, the decor, all of that reflecting and representing the people being served. Of course, communicating in the language and avoiding jargon, and communicating clearly with service recipients about the services being delivered. In addition, when we talk about responding to identity and context, we have to be aware that clinicians oftentimes and service providers oftentimes feel unprepared to provide culturally competent care. Research shows this repeatedly. So it is important for practitioners to engage in critical self-awareness and knowledge building. This means exploring their own biases, thoughts and feelings and behaviors, identifying their assumptions and prejudices about people who are different from them, and that staff acquire knowledge. And knowledge acquisition includes learning from your clients about their personal experiences with things like racism and discrimination and microaggression, but also learning on your own about groups, learning about the history of certain groups on your own, not assuming that your clients can speak to entire groups about their histories and experiences. So, and then of course learning from the community. The communities in which services are being provided often can provide a lot of information about cultural groups and the importance of group membership for service recipients. And then lastly, building strengths. So it is critically important that the goal is for staff to recognize and value strengths in everyone. The rationale is that people exposed to trauma and chronic stress often have strengths that may not be recognized by them or others. So we want to ask questions like, what has helped you in the past? What have you made, or how have you made it this far in your life? How have you coped in the past? How have you managed emotions? What do you do that helps you feel safe? And what has kept you safe throughout your life? These are all questions that we can ask to help identify strengths that people who receive services, again, the children who are receiving services or youth and their parents, understand what they have been able to do and recognize what they've been able to do. So those are the 6 practice clusters. Those are some ideas about how to build a resilience-informed service environment. I want to thank you for your time. And if you have any questions or would like materials from this pre-recorded webinar, please feel free to email me and I can send those along to you. Thank you very much.